Six cardiologists founded the American Heart Association in 1924 in response to their concerns about the lack of heart disease information available to the public. At that time, heart disease patients were considered doomed, limited to living a life of complete bed rest. One of the founders, Dr. Paul D. White of Boston and president of the American Heart Association in 1941, once described the early years as a time of almost unbelievable ignorance about heart disease. The early efforts of the American Heart Association to overcome that ignorance included enlisting help from hundreds, then thousands of physicians and scientists. Since 1949, the American Heart Association, or AHA, has grown rapidly in size, financial resources, involvement with medical and non-medical volunteers, and influence, both nationally and internationally. The AHA moved the National Center from New York City to Dallas in 1975 to better serve affiliates and local divisions nationwide. The volunteer-led affiliates and their divisions formed a national network of local AHA organizations involved in providing research, education, and community programs, and in raising money to support the association's work. The network continues to gain strength as it expands at the grassroots level. Zoom forward. The association's scientific findings now move quickly from laboratories and clinics to physicians' offices and American households. The AHA takes positions on important issues and makes clear, simple statements about controlling the risk factors associated with cardiovascular disease and stroke. Despite strong opposition from the tobacco industry, the AHA continues to be an advocate for the American public, especially children. Finally, and most profoundly, AHA volunteers and staff have transformed the organization into an enterprise that's relevant and vibrant in the 21st century. The American Heart Association has set a bold goal to improve the cardiovascular health of all Americans by 20%, while also reducing deaths from cardiovascular diseases and stroke by 20%. This 10-year goal expands our focus beyond risk factors to promoting cardiovascular health through lifestyle changes and by creating a tangible method to measure better health for all populations. It gives us a clear roadmap to help all Americans live longer, stronger lives. At the American Heart Association, we've set and achieved bold goals before. We worked with many of our healthcare partners to reduce the death rates for coronary heart disease and stroke by more than the 25% target in our 2010 goal. Many said this goal would be impossible to meet, but we achieved major milestones of the goal 2 years ahead of schedule. We did fall short in reducing rates of obesity, diabetes, and physical inactivity, and they remain serious threats. Most Americans are in denial about their health. A recent survey showed 39% rated their heart health as ideal, yet 67% said they were obese or overweight. Fewer than half of adults know their cholesterol, BMI, or glucose numbers. That's unacceptable. All of us who share a commitment to improving the health of Americans recognize that people must live healthier lifestyles to prevent heart disease and stroke from claiming more lives. Our 2020 impact goal is a roadmap to helping all Americans live longer, stronger lives. We'll help them live better lives by empowering them with tools to make minor changes that will make a major difference in their health. Now, as well as giving advice on how not to die, we'll provide tools on how best to live. And by defining categories of increasing health, we'll be able to measure America's progress and our associations in concrete and meaningful ways. There are many leverage points that make the American Heart Association successful. For the first time, we've identified what it means to be in ideal health. This knowledge gives people a measurable goal to strive for and gives us a method to measure our work. Our advocacy department is focused on eliminating trans fats from schools, implementing smoking bans, and creating standards for CPR in schools. In addition, our educational and awareness programs, funding of research, and our healthcare quality improvement programs drive our mission forward and move our organization toward success. Additionally, our donors, staff members, and most importantly, our volunteers help drive their leverage points to make the American Heart Association successful. The American Heart Association is effective because we're an innovative, leading health organization that gives a tremendous amount of thought to how we can reach out to at-risk populations. When we learned that women had the highest risk of heart disease, we created our Go Red for Women cause campaign and encouraged women to go red on the first Friday in February. In addition, we have cause campaigns targeting diverse populations, such as our African American-focused Power to End Stroke and Hispanic-focused Go Red por tu Corazón campaigns. We've established critical quality of care programs like Get With the Guidelines, which improves care in more than 35% of this country's hospitals every day. In fact, the American Heart Association participated in a research study with the National Office of Minority Health and several Houston-based institutions, which showed that the implementation of quality improvement programs in hospitals, such as Get With the Guidelines, significantly reduced health disparities. If every hospital adopted the Get With the Guidelines program, we would see a substantial decrease in health disparities, which by and large have not changed in decades. Get With the Guidelines is the AHA's nationally recognized hospital-based quality program. It's designed to continuously improve care for patients suffering from cardiovascular disease and stroke. Essentially, we bridge the gap between knowledge and practice. This in-hospital program provides a robust registry, decision support, real-time benchmarking, and other performance improvement methodologies for the goal of enhancing patient outcomes and ultimately saving lives. It helps to ensure that every patient is treated according to the latest scientific guidelines. Fewer than half of all heart attack and stroke patients are treated according to the guidelines. Our program aims to change that trend. We collaborated with the Joint Commission for the Accreditation of Healthcare Organizations to develop a primary stroke center certification program. And we collaborated with foundations to start another multi-million-dollar research initiative, this one aimed at stroke. In less than a decade, we've expanded care to ensure that over 200 million people, or 66% of the U.S. population, live within 30 miles of a Get With the Guidelines stroke hospital, an idea that didn't even exist 8 years ago. Each year, thousands of patients who suffer a severe heart attack, known as STEMI, or the most deadly heart attack, fail to receive specific, critical care in a timely fashion. Mission Lifeline is another one of the AHA's national initiatives to advance systems of care for STEMI patients. This program helps train paramedics to recognize when you're having a STEMI, determine which hospital is equipped to most effectively address this type of cardiovascular event, and make sure it happens quickly. Such an enormous endeavor requires great collaborative efforts. The AHA has reached out to thousands of individuals, organizations, and institutions in an effort to improve the entire nation's quality of acute cardiovascular emergency care. Mission Lifeline's 4 areas of focus are EMS system assessment and improvement, establishing local initiatives, evaluating existing models, and exploring the possibility of a national STEMI certification program. Although Mission Lifeline currently focuses on improving the system of care for nearly 400,000 patients who suffer from STEMI each year, the American Heart Association seeks to improve care for all heart attack patients. These are just a few examples of our work in the last decade. It's important to note that none of our successes would be possible without the more than 22 million volunteers that support our efforts each year. Our incredible group of volunteers and supporters, including leading medical institutions, corporations, and survivors, allow our organization to expand our footprint within the communities we serve. The American Heart Association has set a challenging 10-year goal to improve the cardiovascular health of all Americans by 20%, while also reducing deaths from cardiovascular diseases and stroke by 20% by the year 2020. We call this initiative 2020 Impact. The American Heart Association will achieve its mission by providing knowledge-based solutions for people of all ages at all levels of risk, leading efforts in research, prevention, and treatment, and serving global cardiovascular and stroke health needs as a partner of choice for researchers, systems providers, and consumers. With our 2020 Impact goal in mind, the American Heart Association research community will strive to ensure that highly meritorious research and discovery continues. This includes our efforts to support early cancer investigators, to speed the discovery of new ways for people to maintain and improve their health, and to set a research agenda focused on helping people maintain the best possible health at all stages of life. The AHA is blessed with an extraordinary staff, and our staff volunteer partnerships have led to some momentous achievements over the years. I am confident that we are ready to tackle what may be our greatest challenge yet, to change the unhealthy behaviors of our nation as a whole, to improve health while still driving down death rates from these pervasive public health threats. Many people are unaware that the American Heart Association seeks to improve the quality of care that patients receive from the time a cardiovascular event takes place until the time they arrive at the hospital. Our Mission Lifeline program focuses on improving the system of care for the nearly 250,000 people who suffer from a STEMI, the deadliest type of heart attack, each year. Through Mission Lifeline, the American Heart Association provides a set of guidelines that equips STEMI systems of care across the nation to improve timely access to appropriate medical treatment, ultimately saving lives. We're well known for our special event and cause campaign fundraising, but many are unaware that the association has funded billions of dollars in research since 1949, and we've funded more research than any organization outside of the federal government. In fact, nearly 80% of every dollar AHA receives goes towards advancing its mission. The American Heart Association also has a variety of community outreach programs tasked with improving the health of Americans through access to fresh vegetables. Most recently, we've created American Heart Association teaching gardens to provide curriculum around healthy choices for schools. These gardens are teaching children the importance of living healthy lives now before it's too late. Since 1949, the American Heart Association has spent billions of dollars on research to increase our knowledge about cardiovascular disease and stroke. The American Heart Association has accomplished many breakthrough medical advances through this funding. Plus, our research programs have contributed to many important scientific advances, including the first artificial heart valve, techniques and standards for CPR, implantable pacemakers, treatment for infant respiratory distress syndrome, cholesterol inhibitors, microsurgery, and drug-coated stents. We grew our emergency cardiovascular care program from a domestic operation to an international program that now trains over 12 million people every year in hundreds of countries around the globe. This means that millions more people get life-saving training to use CPR or an AED, automatic external defibrillator, to save life, maybe even the life of a loved one. We've led the way with important legislative and regulatory changes at the local, state, and federal level that have helped to improve the overall health of people in our country. We've also raised billions of dollars in the past decade from our campaign and bequest income that has been invested in providing knowledge-based health solutions, leading efforts in research, prevention, and treatment, and serving global cardiovascular and stroke health needs. To ensure that knowledge discovery continues, the American Heart Association is committed to supporting early career investigators. We're second only to the federal government in funding cardiovascular and stroke research. Yet our combined efforts fall short each year, forcing many promising young researchers into other careers because only a fraction get the funding they need. To avoid losing a generation of researchers, we award about 81% of our research dollars to early career investigators. Our research programs have contributed to many important scientific advances, including the first artificial heart valve, techniques and standards for CPR, implantable pacemakers, treatment for infant respiratory distress syndrome, cholesterol inhibitors, microsurgery, and drug-coated stents. Yet we need more resources to attract and encourage promising scientists to enter careers in cardiovascular and stroke research, to fund high-quality research projects, and originate new programs to meet the needs of the medical community. For example, although we funded over 900 new research awards in 2009 and 2010 alone, we didn't have the additional funds needed to cover just over 600 other highly meritorious grant and fellowship applications. That means many scientific projects were shelved and the knowledge that would have resulted from them deferred. In addition, heart disease is largely a silent killer, not identifiable by the naked eye. With cancer and some other illnesses, people can visually tell when a person is sick. But with heart disease, a person may never know until it's too late. And with 80% of heart disease being preventable, sometimes AHA lacks sympathy from the medical community. Plus, because we're a national nonprofit with high-profile donors, we're often under the misconception that we have unlimited financial resources, which is simply not the case. With additional resources, the American Heart Association would be able to fund new and innovative programs that otherwise would not be possible. Since health and wellness is critical to the quality of life of all Americans, the American Heart Association seeks to remain an industry leader in providing scientific evidence that ideal health is attainable. Additional funds will benefit a variety of programs, including the ability to provide widespread CPR training for the community. CPR can more than double or triple a person's chance of survival. In fact, for every minute that CPR is not performed, a person's chance of survival decreases by 7 to 10% each minute. Yet, many still choose not to learn CPR. When you consider that 80% of all out-of-hospital cardiac arrests happen in the home, the need for bystander CPR is even more evident. The American Heart Association has identified a chain of survival of cardiac arrest. Bystander CPR is the second and weakest link in this chain. The steps include: number 1, call 911. Number 2, administer bystander CPR. 3, use an AED. 4, advanced care such as EMS or a hospital. And number 5, post-cardiac arrest rehabilitation. There is much research that indicates strengthening the chain of survival leads to a greater sudden cardiac arrest survival rate. As we all know, a chain is only as strong as its weakest link. The American Heart Association CPR Anytime Kit is an innovative product that was created to break down the barriers that keep people from taking a traditional certification course and to strengthen the chain of survival. CPR Anytime reduces course time to increase participation, reduces reliance on an instructor to increase training availability and efficiency, and uses a video self-instructional format to make home use possible. Its simpler and friendlier presentation helps to increase trainee self-confidence. The best part of CPR Anytime is that once a person is trained, they get to keep the kit and train their family and friends. With our CPR Anytime Kit, we're able to teach bystander CPR in less than 20 minutes and provide a take-home package so that the trainee can become the trainer. We've found that up to 10 people can be trained with one of these affordable kits. In a time when so many Americans are suffering from heart disease and stroke, the odds are many of us will be faced with a life-threatening situation at some point. Being equipped with this knowledge allows everyday people to help save lives. With additional funding and support, our organization could further our research efforts, address specific community health issues, and advance policies to support our efforts. The American Heart Association funds investigator-initiated career development and knowledge discovery projects through its research programs. We're also committed to identifying and supporting specific science areas deemed critical to achieving our mission and strategic objectives. Foundation and corporate support for such strategically focused research, as well as partnerships with other professional organizations, allow the AHA to fund special initiatives or awards. Our research programs have contributed to many important scientific advances, including the first artificial heart valve, techniques and standards for CPR, implantable pacemakers, treatment for infant respiratory distress syndrome, cholesterol inhibitors, microsurgery, and drug-coated stents. Yet we need more resources to attract and encourage promising scientists to enter careers in cardiovascular and stroke research, to fund high-quality research projects, and originate new programs to meet the needs of the medical community. For example, although we funded over 900 new research awards in 2009 and 10 alone, we didn't have the additional funds needed to cover just over 600 other highly meritorious grant and fellowship applications. That means many scientific projects were shelved and the knowledge that would have resulted from them deferred. Of dire importance to the AHA is making a significant impact in communities that are experiencing a high burden of cardiovascular disease and stroke. These marginalized populations often live in communities where there is little to no access to fresh fruits and vegetables, safe recreational areas, or primary medical care. In addition, these communities tend to have very high concentrations of poverty and little access to economic opportunities. With further funding, the American Heart Association can implement evidence-based interventions that will substantially improve the health of individuals in these communities. For example, a primary source of nutrition in most of these communities is the local corner store. Evidence indicates that if you have a corner store in one of these communities regularly stocked with fresh fruits and vegetables, the overall obesity rate significantly declines. Imagine if the air in your office was continuously pumped with arsenic, carbon monoxide, asbestos, and 4,000 more chemicals. Or when you call 911 for a stroke, the medics who pick you up do not have guidelines for how to diagnose you or where to take you. As a result of the American Heart Association's advocacy efforts, there are policies that protect you from these circumstances. Of critical importance to the advocacy arm of the American Heart Association is the childhood obesity epidemic. Today, about 1 in 3 American kids and teens is overweight or obese, nearly triple the rate of 1963. With good reason, childhood obesity is now the #1 health concern among parents in the United States, topping drug abuse and smoking. Among children today, obesity is causing a broad range of health problems that previously weren't seen until adulthood. These include high blood pressure, type 2 diabetes, and elevated blood cholesterol levels. There are also psychological effects. Obese children are more prone to low self-esteem, negative body image, and depression. There is no one cause of obesity. It can be influenced by lifestyle habits, environment, and genetics. But in the majority of cases, it boils down to a pretty simple equation. We're taking in more calories than we're burning. It's imperative that we direct our efforts to addressing this epidemic through removing trans fats from school lunches, maintaining physical education requirements, and advocating for CPR training.